Dr. Starr Hampton is the Interim Chair and Chief for the Department of Obstetrics and Gynecology with Women and Infants Hospital. Starr, thank you so much for joining us today.
Thank you for having me.
Let's talk a little bit about Women and Infants Hospital being open throughout COVID and still taking great world-class care of our patients.
Yeah, so Women and Infants, clearly taking care of many or most of the Rhode Island's population of women, has remained open throughout the COVID pandemic to care for women in their pregnancies. Our labor and delivery team has been phenomenal, taking care of women throughout this pandemic. In addition, we've done emergent surgeries and needed surgeries for women and seen women in our outpatient practices as needed for emergency visits.
So clearly, patients should feel safe to come back to the hospital. Wouldn't you agree?
So right now, Raina, yes. So now that Rhode Island is starting to open, we're opening many more of our facilities as well as our service lines for women. For example, you can book your mammography now. You can come back to all of our ambulatory settings to have your visits in person and not only telehealth visits. And we are also opening to non-emergent surgeries. It's an extremely safe place to be. We're doing this with obviously all of our precautions in place. Providers are masked, patients are masked. We do it and need it for our surgical patients as well as our labor and delivery patients. And we do things like space visits, make sure our waiting rooms are nice and empty so that you're not in a waiting room right next to another person. So we're taking many precautions, extra cleaning, clearly all of the precautions that are needed in order to bring patients back to the hospital and its ambulatory settings in a safe way.
Tell me how successful telehealth has been at Women and Infants Hospital for patients.
So this has been a really great time for us to explore telehealth more and see how it's worked for patients as well as providers. It really was an extra boost for us to get our telehealth up and running and working very well. And it's been, as a provider who has had telehealth and Zoom visits with patients, it's really quite remarkable how much information you can get from a patient and how much information you can give a patient over Zoom or the telephone when you can't see them in person. But of course, it doesn't substitute for an inpatient visit, especially when a physical exam is needed, or some of the more important things that we can do in person with our patients. So I still would very much encourage patients to come in to those ambulatory settings.
Dr. Starr Hampton, Interim Chair and Chief for the Department of Obstetrics and Gynecology at Women and Infants Hospital. Thank you so much for joining us today.
Thank you.